Morning people wake up for peace and quiet. McDonald's breakfast people, we wake up for the sweet rush of getting that warm, delicious breakfast right before it ends.
Hotcakes, sausage patty, hash browns, scrambled eggs, biscuit, real butter and syrup. You know how our big breakfast got its name, and you know where your whole family can share one for just $6. McDonald's. Limited time only. Price and participation may vary. Cannot be combined with any other offer or combo meal.
Ba-da-ba-ba-ba.
You're listening to In Good Health, the trusted news source for medicine, science, and technology. I'm Elizabeth Westfield.
I'm Mayan Vasta Betancourt.
And I'm Greg Johnson. This week, who should decide which pieces of knowledge are valuable?
Are we going to allow the university to have a monopoly on the definition of knowledge or not? And, I prefer a world where it doesn't, even if I'm part of it.
But first, how to treat a pelvic organ prolapse.
Because it's perceived as maybe normal with aging, I think we have to kind of get rid of that and say it's common with aging, but you don't have to live with this quality of life because we've got options for you.
All that and more this week on In Good Health.
Morning people wake up for peace and quiet. McDonald's breakfast people, we wake up for the sweet rush of getting that warm, delicious breakfast right before it ends.
Hotcakes, sausage patty, hash browns, scrambled eggs, biscuit, real butter and syrup. You know how our big breakfast got its name, and you know where your whole family can share one for just $6. McDonald's. Limited time only. Price and participation may vary. Cannot be combined with any other offer or combo meal.
Ba-da-ba-ba-ba.
Staying active as you age is such an important part of maintaining your physical, mental, and emotional health. And being outdoors while you move is even better. Some of Jane's favorite hobbies were hiking and taking long walks. So when she began experiencing some bladder leakage and uncomfortable pressure in her pelvic area, it changed her entire lifestyle.
I couldn't be very far from a bathroom. That was one of the problems. But also the pressure was getting heavier and heavier, so it didn't feel good. And if you're hiking and you're really using your core and your pelvic muscles and, all of that, you don't have the strength that you need. I could keep up with my social activities as long as I knew where the bathroom was and as long as I knew how long I was going to be there.
Jane's symptoms kept getting worse, and she began having bowel movement problems. The constant fear and worry forced her social life to get smaller and smaller, which only added to the stress.
I had to buy a purse big enough that could hold my supplies in case I had an accident. I couldn't wear one of those cute little crossbody bags. They didn't have enough room for me. And I thought, this is ridiculous. So I think all of that, mentally and emotionally, the limitation of my activities, this constant fear of, am I going to have an accident? Do I need to get somewhere or not go somewhere because I'm scared I'm going to have an accident? That's just no way to live.
Her breaking point was when the pressure she had been feeling became a visible bulge coming out of her vagina.
The bulge gets so bad, you can actually feel it and you can see it. And it's scary. So when that happened, I went to my primary care doctor and I said, I don't know what's happening, but something is coming out. And she took a look and she said, I don't know which it is, the bladder or the vaginal wall, a vaginal bulge. Let's go to your gynecologist. So she set me up with a great gynecologist in the area where I live. And he took care of me. He told me it was a vaginal bulge and that I was having a prolapse. I had no idea your vagina could collapse. I mean, who tells you that?
Jane was experiencing a pelvic organ prolapse. The condition occurs when the pelvic muscles become too weak to hold up at least one of the organs sitting on top of it, including the vagina, uterus, bladder, and rectum.
Imagine the pelvic floor like a hammock. The pelvic organ prolapse of the bladder, the uterus, the rectum all rest on this hammock of muscles called the pelvic floor. So basically what a prolapse is, the uterus, the bladder, or the rectum pushing on the vaginal wall, and it can create a bulge in the vagina or it can create a bulge that comes outside of the vagina.
That's Dr. Savitha Krishnan, a urogynecologist at Camino Health. People experience different symptoms depending on which organ is pushing on the vaginal wall. The uterus can cause painful intercourse, and a sagging bladder or rectum can make it difficult to fully empty when going to the bathroom.
So there are so many women, Kristen, that come in and they actually have to put their fingers into the vagina. There's even a medical term for this called splinting, where they have to put their fingers in the vagina and they actually have to push on that back wall of the vagina to get the stool to come out. If the prolapse is out, and if the bladder or the uterus is involved, they actually have to put their fingers in and push the bladder up to start urinating.
It's estimated that nearly half of women will experience pelvic organ prolapse, partly because some of the risk factors are unavoidable, like menopause. Others include chronic constipation, having babies with large birth weights, and vaginal childbirth.
Multiple vaginal births, operative deliveries, so like forceps deliveries increase your risk of prolapse almost eightfold. Vacuum-assisted deliveries, and interestingly, hysterectomies.
A fact that Jane was not made aware of when she had her own hysterectomy more than 20 years ago after she experienced a uterine prolapse.
The uterus literally was falling out. It was falling down the vaginal canal. You can feel it, you can touch it, you know it's not supposed to be there. And so my gynecologist, she said, yeah, you've had a uterine prolapse. We're going to have to give you a hysterectomy.
Since she'd had a complete hysterectomy, Jane didn't realize she could experience a prolapse again, or that she had an even greater chance because of her operation.
Now we're at, 2020, and we're in the store buying diapers because we've had a vaginal prolapse, we've had a bladder that shifted, and now everything's coming down and smushing the rectum, so you're having bowel problems.
Despite how her symptoms were impacting her life, Jane was hesitant to seek treatment. The hysterectomy had taken such an emotional toll that she didn't want to have to go down that path again. But what many women don't know is that there are many treatment options available instead of surgery. For a mild prolapse, physical therapy is a great option.
So in Europe and in Asia, a lot of times after vaginal childbirth, physical therapy is not elective. It's actually pretty routine that people get pelvic floor physical therapy. And in a lot of those countries, the intervention rate for surgery is less. The incidence of prolapse is less. So we know that probably early intervention with pelvic floor physical therapy is helpful. When we see patients with early stages of prolapse, we always offer physical therapy because it's a nice conservative route. And if a patient will continue to do it lifelong, that's an excellent route.
The only issue in America is that people don't stick with the program. A new survey by the Ohio State University Wexner Medical Center reveals that 3 out of 4 patients don't complete their physical therapy homework.
So I always tell people, if you're going to invest into physical therapy, just realize it's something that you need to continue to do the rest of your life so you can make that investment fruitful.
While you can't fully reverse the condition with physical therapy alone, Krishnan says an effective program can improve a prolapse by 1 centimeter. Another option for more advanced prolapses is called a pessary. It's often a soft silicone ring that's inserted into the vagina and gives more support to the pelvic organs. While it doesn't fix the prolapse long-term, it does provide symptom relief. Many people like Jane try out the pessary when they are really trying to avoid surgery. Unfortunately for Jane, the pessary wasn't enough to help her reclaim her social life. There are a couple surgical options to choose from, but a lot of the decision depends on how much the prolapse has progressed.
So we've got procedures that are done vaginally where we can keep the uterus and support the top of the vagina and get everything supported well. And those were our traditional surgeries for prolapse, vaginal surgeries, either removal of the uterus in support of the vagina or keeping the uterus and supporting the vagina. And those we know have great success if you're early in your prolapse journey. But if the prolapse is already significantly out of the vagina, we know that using your own ligaments is not so successful. So then this procedure called the sacrocolpopexy has a much better success rate. So the sacrocolpopexy actually has a 94 to 96% success rate lifelong of never having intervention for prolapse.
This procedure used to be done going through an opening in the abdomen, much like a C-section incision. However, that required a few days in the hospital and then 6 weeks of recovery. Now, most surgeons have transitioned to a laparoscopic procedure, which uses a much smaller incision.
But this is a daunting laparoscopic procedure because you're actually putting a lightweight piece of mesh on the front wall of the vagina, back wall of the vagina, and you're sewing that mesh down on the front wall and back wall because you're giving, instead of using your own ligaments, you're using that graft as your support. And that's why the success rate is much, much higher with this procedure than using your own ligaments. And that's why when you have an advanced prolapse and those ligaments are all really stretched out, this works better for patients because you're not using stretched out ligaments, you're using that strength of that synthetic mesh. But because there's so much suturing that's involved, laparoscopic procedures can take somewhere between 4 and 5 hours.
But in recent years, some surgeons have been using robots to assist the procedure, which has drastically cut the operation time.
So the robotic procedure has allowed us to take this 4 or 5, sometimes, when I go into academic institutes, sometimes 6-hour procedures down to about 2 hours, 2 hours and 10 minutes.
The surgeon uses small robotic arms to sew in the mesh, which allows them more control and precision.
You're really in charge of everything. So you're moving the robotic arms, but instead of having straight sticks and trying to tie knots with straight sticks, you've got an articulated wrist. So that articulated wrist really allows you to tie knots very efficiently to actually get the procedure done much, much quicker. When you operate robotically, you're also not like when you operate straight sticks, sometimes because you're a human and you're moving your instruments, the port's moving with you too, causing a little bit of trauma to the tissue there. So when you're operating robotically, the instruments, that the port's stable. So the robot is basically moving, the port is not moving as much in the skin as it does with straight stick.
Meaning that the patients have less pain at the incision site. Not only is this operation much faster, but most patients are able to go home that same day.
And then we call everyone the next day. And most patients are going, tell Dr. Krishnan, I'm out on my walk. I just took a Motrin. So they're walking. So I usually tell people, go out by 2 weeks. I'd like to see you up to 2 to 3 miles. Because the more walking you do, the better you're going to heal, the less clots you'll have in your legs, the better you're going to open up your lung fields, right? You're just going to heal better and feel better if you actually get out there and move.
So instead of the 6-week recovery, Krishnan says most of her patients are back to work after 2 weeks. A couple days after Jane had her surgery, she was already walking around the block. And not long after that, Jane was finally able to reclaim her life.
I had to build up my confidence. And I took some longer walks than I normally take to see if, how do you feel, Jane? Can you hold it in, before you get to the bathroom? And I could. That was incredible to me. That was something so simple that had been so hard was now routine. I was back to normal.
Krishnan hopes women become more aware of the treatments for pelvic organ prolapse because there are life-changing options, and no one should let feelings of shame or embarrassment keep them from living a full life.
We see these patients that are just living with miserable qualities of life for such a long period of time. So I'm just thinking somewhere along the way, we've got to increase the awareness that they get to the right place earlier because we have such great options. And it's funny, because it's perceived as elective, because it's perceived as maybe normal with aging, I think we have to kind of get rid of that and say it's common with aging, but you don't have to live with this quality of life because we've got options for you.
You can find more information about Dr. Savitha Krishnan and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our executive producer is Amira Zaveri. I'm Kristen Farah.
Coming up, the history of astrology when In Good Health returns.
Bring on the off-road. Bring home a new Honda. With a great deal on your favorite Honda vehicles. Conquer trails and back roads in cars built for exploring. With the rugged Honda Pilot, Ridgeline, CR-V, and Passport, the road might stop, but you're not done. All from the 2025 Kelley Blue Book Best Value brand.
Based on 2025 Consumer Choice Awards from Kelley Blue Book, visit kbb.com for more information.
Can the planets and stars truly reveal intimate parts of our lives? Astrology is an ancient practice that survived many iterations to what we know it as today. It was removed from academia in the 17th century, but has made a resurgence in the last couple hundred years. With it once again growing in popularity, does it deserve to be reinstated as legitimate science? Steven Vandenbroek, professor of history of science at Ghent University, says that while he believes there's value in appreciating alternative practices like astrology, he doesn't think it's needed in our current institutions.
I think the knowledge practices that astrology stands for, I don't think they really have a place anymore in the sort of epistemic regime, if that's an all right expression to use, in that the modern university is built around. You know, we inhabit the world, and thankfully so, of double-blind tests and et cetera, and, you know, things that astrology typically doesn't survive. I don't think you can turn back time. I think it would be a silly thing to do. Nobody's really waiting for that, in my opinion. One of the things that you learn as a historian, or that I learned as a historian, is that time has a direction and you can't undo it. That time is past, I think. But it's past for the university. It's not past for society at large.
Which is a major distinction. Just because academia doesn't see a strong value in astrology doesn't mean it can't be a meaningful tool. It turns out that higher education's shunning of astrology hasn't had much of an effect on how the general public views the practice. The National Science Foundation has been monitoring public perception of science and technology for decades. The poll results for astrology have been pretty consistent since the 80s, and we've even seen a slight increase in people viewing astrology as scientific.
And what typically comes out is, first of all, about 40%, if I remember well, of the American population thinks that astrology is kind of scientific. About, if I remember well, about 15% doesn't really have an opinion on it. And then there's about another 40% that thinks it's rubbish, right? Interestingly, those are about the same scores as sociology and economics. And history fares a lot worse.
Now, it's important to note that people have different definitions for the term scientific, which can skew the results. But even if they don't all believe in it, Vandenbroek says it does show that a lot of Americans aren't entirely discrediting it.
The statistics suggest that a lot of people today still think there is a lot of meaning in knowledge practices that don't necessarily survive the criteria that the universities wield for their own reasons. So knowledge is a broader category than the university or than the present might lead you to believe. We also know that annual expenditure worldwide on astrological consultancy services are roughly equal to the national GDP of countries like Armenia or Congo, if you like. So my point simply being, the public won't wait for the institutions to give their benefit, to give the benefit, to give a kind of stamp of approval. These things happen, whether we like it or not.
For many people throughout time, astrology has provided a meaningful framework for life. In a world with so many uncertainties, it acts as an anchor in the chaos, even in the more serious aspects of life.
I've met many people over the years who use it for checking their financial situation, how it's going to evolve. It's very well known that in the world of economics, even high-level investment banking, astrology does get used from time. They'll never say it openly, but it does happen. I mean, people do consult the stars to find out how portfolios are going to change.
Astrology's been at the intersection of insurance, weather prediction, and medical diagnoses. Similar to how religion provides a purpose and community, Vandenbroek says the same can be true for astrology. Netta Farr, a self-taught astrologist, has seen this firsthand through the thousands of readings she's done for others.
I know how many people that I've helped make decisions. They really needed an astrological guidance in making a major life decision. And 6 months later, they come back to me and they tell me how much they are grateful for that decision being made for them. Instead of living life with so much uncertainty, astrology really gives you guidance in the decisions you should be making that are best for yourself.
In her own life, Farr was able to confront some harsh but much needed lessons by interpreting her astrological birth chart. According to astrology, knowing the date, place, and time of your birth can clue you into pivotal moments in your life. 12 aspects of life, such as relationships, finances, and personality, are divided into sectors called houses. As the planets move in and out of them, it alerts you to major events of your past, present, and future. Once Far's birth chart was complete, she was shocked to see how closely it aligned with her lived experience.
Seeing those planets be in past placements and things that I already went through, I didn't realize how specifically they were targeting those areas of my life. I think an example is in the 4th house, which is the house of home. I had the planet of death and rebirth, Pluto, and I didn't realize the reason that I had to go through so many different phases of my home and family life was because that planet was trying to push me into finding the perfect version of that house, the 4th house. So the perfect version of home and family. But there's a lot of shadow work that was being done in that. And I was resisting that. But if I had known that the planet was there to help me and guide me through that, then I would have released the reins a little bit, been less reactive.
Even though the practice can't always hold up under scientific testing, Far is confident that astrology has helped her navigate a purposeful life. From religion to superstition to trendy supplements, there are a lot of things in our lives that we value even if science can't always back it up. Vandenbroek argues that this personal significance can be just as important as something that has an academic stamp of approval.
Are we going to allow the universe to have a monopoly on the definition of knowledge or not? That's basically what's at stake here, I think. And, I prefer a world where it doesn't, even if I'm part of it.
You can find more information about Netta Farr, Stephen Vandenbroek, and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.
In Good Health returns in just a moment.
Bring on the off-road. Bring home a new Honda. With a great deal on your favorite Honda vehicles. Conquer trails and back roads in cars built for exploring. With the rugged Honda Pilot, Ridgeline, CR-V, and Passport, the road might stop, but you're not done. All from the 2025 Kelley Blue Book Best Value brand.
Based on 2025 Consumer Choice Awards from Kelley Blue Book, visit kpp.com for more information.
Medical notes this week. Your weight could affect how well your brain works as you get older. Cognitive decline happens to all of us as we age. A long-term study published in the Journal of Neurology that followed people over the age of 50 has found that having a higher body mass index over time is linked to a more rapid decline in memory and executive functions like concentrating and organizing. Thankfully, it may be reversible. People who successfully managed their weight saw a significant slowing of cognitive decline in as little as 2 years. A newly discovered type of cell could be a powerful defense against liver disease. Research published in the Journal of Clinical Investigation has identified a unique cluster of liver cells that only appear in livers affected by MASH, a dangerous condition that leads to cancer. Scientists found that these cells activate a gene that helps the organ adapt to metabolic stress. This discovery offers a new therapeutic target to protect the liver from chronic damage and stop the progression of metabolic disease. How coral reefs could become the next biggest pharmaceutical product. Researchers have discovered more than 3,000 new species of bacteria living exclusively within coral microbiomes. These bacteria produce a lot of different types of small molecules used to grow, communicate, and defend themselves. Scientists believe these molecules can be used for new drugs, as well as industrial products like laundry detergent and concrete. The research is published in the journal Nature. And finally, many beauty products marketed as clean have a dangerous secret missing from their labels. 70% of products tested in a recent study listed fragrance as an ingredient, which can hide endocrine-disrupting chemicals. This study highlights a critical gap in cosmetic regulation and underscores the need for better labeling. The research is published in the Journal of Exposure Science and Environmental Epidemiology. And that's Medical Notes this week. I'm Mayan Vost.
Bring on the off-road. Bring home a new Honda. With a great deal on your favorite Honda vehicles. Conquer trails and back roads in cars built for exploring. With the rugged Honda Pilot, Ridgeline, CR-V, and Passport, the road might stop, but you're not done. All from the 2025 Kelley Blue Book Best Value brand.
Based on 2025 Consumer Choice Awards from Kelley Blue Book. Visit kpp.com for more information.
Betancourt.
Thank you for joining us this week and every week as we break down the science stories you need to know. You can find all of our past segments and guests on our website at ingoodhealthpodcast.org or wherever you listen to your podcasts. Follow us on Instagram, Facebook, and X for more behind-the-scenes content. Tune in next week for another edition of In Good Health.
From small towns to big cities, Comcast is connecting millions of Americans to affordable, reliable, and secure Wi-Fi at prices that are clear and consistent with the new 5-year price guarantee. Backed by AI innovation, resilient design, and cybersecurity technology, the Comcast network is built to keep families and businesses connected and their data safe. Learn more about how Comcast is investing in a more connected America at ComcastCorporation.com/investment.
Morning people wake up for peace and quiet. McDonald's breakfast people, we wake up for the sweet rush of getting that warm, delicious breakfast right before it ends.
Hotcakes, sausage patty, hash browns, scrambled eggs, biscuit, real butter, and syrup. You know how our big breakfast got its name, and you know where your whole family can share one for just $6. McDonald's. Limited time only. Price and participation may vary. Cannot be combined with any other offer or combo meal.
Ba-da-ba-ba-ba.